Have you ever experienced pain after staring down at your phone for a prolonged period of time? If so, you've experienced an overuse injury known as text neck. Hello, my name is Cheyenne Barlow. I'm a freshman health and exercise science major at Bridgewater College. I plan on pursuing a master's degree in athletic training, and today I'll be talking about overuse injuries. Overuse injuries are injuries to our muscles, bones, tendons, and ligaments caused by repetitive movement and stress over time. Overuse injuries can happen to anybody. In fact, I'm sure most of you have been affected by an overuse injury in your own lives. Going back to text neck, this is a term used by U.S. chiropractor Dr. D.L. Fishman to describe an overuse injury of the neck caused by using a handheld device for an extended amount of time, resulting in pain, stiffness, and soreness in the neck. Although overuse injuries typically occur in athletes, it's important for everyone to be aware of them, as they can also occur in elderly people, people working manual labor jobs, and even people working desk jobs can be affected by carpal tunnel, an overuse injury caused by extended amount of time typing on a keyboard. And if left untreated, overuse injuries can lead to much more severe issues, like stress fractures and prolonged pain. Since my focus is in athletic training, today we will be focusing on overuse injuries in athletes, specifically rotator cuff tendonitis in throwing athletes, and we will be going over what rotator cuff tendonitis is, how it occurs, and how it can be treated. What is rotator cuff tendonitis? In order to understand what rotator cuff tendonitis is, it is first important to understand the anatomy of the shoulder. The shoulder is composed of three main bones, as you can see in the top picture. There is the clavicle, scapula, and humerus. The shoulder is a ball and socket joint formed between the head of the humerus and the scapula. The bottom picture shows the muscles that make up the rotator cuff: the supraspinatus, subscapularis, infraspinatus, and teres minor. These muscles are responsible for holding the head of the humerus in place and for controlling the lifting and rotating of the arm. The tendons attaching these muscles to the humerus are what is affected by rotator cuff tendonitis, which is simply defined as inflammation of the rotator cuff tendons. Symptoms of rotator cuff tendonitis include pain, particularly with throwing, lifting the arm, and even at rest. Symptoms also include swelling, stiffness, and tenderness in the shoulder. So how does rotator cuff tendonitis occur? Rotator cuff tendonitis typically occurs through repeated stress on the rotator cuff muscles and tendons. One particular motion that puts the rotator cuff under high stress is the throwing motion. In fact, the American Academy of Orthopedic Surgeons states that the rotator cuff is one of the shoulder structures most vulnerable to throwing injuries. To the right, you can see a diagram including the phases of the throwing motion. You have the wind-up, early cocking, late cocking, acceleration, and follow-through. According to an article from the American Academy of Orthopedic Surgeons titled Shoulder Injuries in the Throwing Athlete, which can be found in the description below, the rotator cuff is put under high stress during the follow-through phase, where it must handle significant stress in order to decelerate the arm and retain control over the humeral head. Since the rotator cuff is put under this high stress with each throw, it can quickly become overworked, which could cause irritation and inflammation, resulting in tendonitis. According to an article from Johns Hopkins Medicine titled Rotator Cuff Tendonitis, which can also be found in the description below, rotator cuff tendonitis can also be caused by the pinching of the rotator cuff tendons between the acromion, which is part of the scapula, and the humeral head when the arm is lifted overhead. This pinching is known as impingement and can be seen in the diagram to the right. Since throwing is an overhead motion, and this pinching occurs when the arm is lifted overhead, pinching can occur with each throw. And repetitive pinching can cause irritation and inflammation, which could result in tendonitis. So how is rotator cuff tendonitis treated? A study published by Stapp-Rolls in July 2020 titled Rotator Cuff Tendonitis concluded that rotator cuff tendonitis can be treated through both operative and non-operative measures. The study mentions that non-operative treatments of rotator cuff tendonitis include physical therapy as a first-line treatment, stating that patients can be managed through physical therapy alone. Anti-inflammatory medications can also be used in conjunction with physical therapy. However, they are only moderately recommended. Cortisone injections into the subacromial space can also be used prior to physical therapy, allowing for symptomatic relief instantaneously. Patients also may benefit from initial periods of rest following repetitive overhead activities. According to the same study, surgical procedures can also be used in more severe cases. One example of a surgical procedure used is acromioplasty, which is shaving of the underside of the acromion to allow for more space between the acromion and the rotator cuff tendons, which could decrease pinching. A link to this study can be found in the description below. It is important for athletes with rotator cuff tendonitis to seek treatment early, as if left untreated, rotator cuff tendonitis can lead to rotator cuff tears, which requires surgery and could put the athlete on the sideline for months. Today we've gone over overuse injuries, specifically rotator cuff tendonitis, which is inflammation of the rotator cuff tendons typically caused by repeated stress. We now know that rotator cuff tendonitis can be treated by both surgical and non-surgical methods, and that it's important for athletes affected to seek treatment early in order to avoid more severe issues. Remember that overuse injuries can affect anybody, not just throwing athletes, and it's important for everyone to be aware of them. Whether you are an athlete being overworked, an older individual experiencing normal wear and tear of muscles and joints, you're working a manual labor job where constant lifting can lead to back issues, you're working a desk job where constant typing can lead to wrist issues, or you are a technology addict who spends hours a day with their nose in their device, leading to neck problems, it is important to understand and be aware of overuse injuries so they can be detected early, and unwanted and preventable issues can be avoided down the road.